All right, everyone, it's just past one, so I'm going to start us off. So welcome to the April Helen seminar. I want to start today's seminar by acknowledging the Aboriginal and Torres Strait Islander people of the unceded land on which we work, learn and live. And in particular, I want to acknowledge the Wurundjeri Woi-wurrung people as the traditional owners of the land where Helen and the Melbourne Law School sit. And we pay our respects to elders past, present and future and acknowledge the importance of Indigenous knowledge in the Academy. So today we're going to be hearing from Fiona Lynch and Danya Vears about how qualitative research can play a role in health ethics research. A lot of you probably already know Fiona and Danya, especially Danya's a very repeated guest at our Helen seminars, so we're very happy that she's come back. So Dr. Fiona Lynch is a lecturer at the School of Medicine at Deakin University and trained as a genetic counsellor at the University of Melbourne. And Danya Vears is a former employee of MCRI with me, but is now an associate professor in ethics and professionalism in the School of Medicine at Deakin University, where she is teaching medical students bioethics and research methods. So how we're going to structure today is Danya will speak first, then Fiona will speak, and then we'll have all the questions at the end. And I will hand over to Danya now to start, and I'll just remind everyone too that this lecture is being recorded. Okay, over to you, Danya.
Well, thank you for having us. We're kind of going to do a little bit of to and froing as well throughout the session, so we'll see how we go. But I'm very happy to be here. We are repeat offenders at this Helen lecture, but we're very happy to be here. So the reason I guess we thought we'd do something a little bit different today is because I guess I've been working in qualitative research for quite a long time, and Fiona has been doing it for quite a long time as well. And we've been working in this space, and we thought it might be nice to sort of share some of our experiences and just give a bit of an overview of qualitative research in this field, just to kind of give people maybe a little bit of motivation to also use some of the methods if they're not already doing so. So I'd also like to acknowledge the traditional custodians of the lands on which I am working and we all are working today. So for me, that's the Wurundjeri people of the Kulin Nation. I'd like to pay my respects to their elders past, present and emerging. So firstly, we're just going to introduce ourselves a little bit more and tell you why we have some expertise in this area and what we do. I'm going to talk a little bit about what qualitative research is and when it's helpful, explain mixed methods research. I'm going to give you an example of how qualitative research can make a difference and how it has in my work. And then Fiona's going to talk a bit more about some different approaches about how to do qualitative research. And then we might, depending on how much time we have, we might go into more detail about that, but hopefully we'll have a lot of time for questions if you've got any at the end. So just to give you a bit more about us. So I guess I've been working in qualitative research officially since my master's degree, which is in genetic counselling, where I did a research project, which was a qualitative project, and that was in 2008. But when I think back, I've actually probably been using qualitative methods since I first came out of university, which was in 2003, where I was doing interviews with patients who had epilepsy and trying to figure out what type of seizures they were having. So that was kind of my foray into qualitative research. But now I use it a lot in all my areas of research, which is all to do with genomics and new technologies. But I also supervise a bunch of students and do some teaching in that space as well. Fee, do you want to talk a little bit more about your experience?
Yeah, didn't realize we were aging ourselves quite so early in this presentation, but I'll go for it. My qualitative research experience really started in my PhD, I would say. So I did a master in genetic counselling, so I'm trained as a genetic counsellor. My research project within my master's was entirely quantitative. So I had that experience and then decided, no, I really want to do some qual. I'd really like to sort of sink my teeth into that. So did a PhD using entirely qualitative methods. Which I'm happy to talk in more detail about later if needed. I then moved into a role with Chris and Danya and team at MCRI, again, using my qualitative skills, but this time more in the bioethics space. So my research now is almost exclusively qualitative with some mixed methods, looking at genetic counselling issues and bioethical issues of new genetic technologies.
Thanks, Fiona. And we do a lot of work together on a bunch of different projects, which has been really great. So just what is qualitative research? I mean, you probably already know, but I guess the aim is to gather and analyze non-numerical data And we do that in order to gain an understanding of people's social reality. And that includes their experiences, their subjective experiences, things like attitudes, beliefs, emotions, and motivations, and other things as well. But that's pretty broad. But it's very useful for exploring all of those things. And I just want to flag that when we talk about qualitative research, it doesn't automatically equate to consumer engagement or co-design. And the reason I say that is because these are words that are very being well used at the moment, and they're very important in grant writing as well. So people often, a lot of grants have requirements that you do either consumer engagement or co-design within your projects. And just to say that they are very specific areas that have certain designs that are necessary, but qualitative research is much broader than that. So just because you're doing qualitative research doesn't mean you're actually doing co-design or consumer engagement, just a flag. So there are lots of different types. There are types of data that can be analysed qualitatively, and some of them are words. So they might be generated specifically for the research, so either through interviews or focus groups, or maybe even when you're doing observations of a particular scenario or setting, you might create your own field notes. So that's where they're specifically designed for that purpose. And then there are also other types of word-related qualitative research data that you can use, and they might be pre-existing. So it might be looking back at personal information about people, so their diaries or letters or something like that. But you can also look at media sources like newspaper articles, reports, social media posts, that kind of thing. And also you can look at existing documents like literature. So it might be looking at particular publications in the literature, or you're looking at guidance documents or recommendations or something like that. They're all pre-existing word types of analysis. But you can also do images as well. So you might be looking at drawings or photos or maps or videos, and these can either be existing or things that you get people to create in order to talk about or discuss in different ways the kind of emotions or experiences that they're having. So why do we use qualitative research in health ethics? Well, we're trying to really understand the human aspects of health-related situations. So that's a very broad setting, obviously, but this is very applicable in lots of different areas. So what we're trying to do is really uncover what's happening in actual real life. So it's trying to engage with people in different ways to understand what's important to them. So different stakeholders might be included in that. And we're often trying to do health research to improve practices or policy. And so we're doing the health ethics research to work with that. There's a much broader recognition now that health-related research needs qualitative research methods, and that's really to try and figure out why things are happening in certain ways, what's working, maybe what's not working, how it might be working, who it might be working for, et cetera, et cetera. And I guess the goal is we want to increase successful outcomes in different contexts. So we're trying to figure out what's going on in a setting. We might want to improve that, or we might want to understand it better. And qualitative research is really good for that. So qualitative research methods in health ethics research can be useful for a bunch of different reasons, but one of the main reasons is when there's not much really known about the area. So maybe you're looking at an area where there isn't a lot of research that's been done already, or maybe there's some quantitative stuff, but not much qualitative, so we don't understand what's going on underneath the surface. It might be sensitive topics, so it might be something like very personal related information. Health related information is often very personal, but might be particularly sensitive, might be to do with mental health or sexual health or something like that. And we want to try and explore what's going on in that setting. So in those situations, people might feel less comfortable filling out a survey. They might be then having a one-on-one conversation with someone, for example. If the issue is about people, I know that's a very broad situation, broad setting, but I guess it makes sense if you think about you want to talk to people. It's probably a good way to understand people is to talk to them, engage with them, rather than just trying to maybe observe them. So that's another setting. But I guess the thing about qualitative research is it can be really helpful to sort of uncover and unlock puzzles. So we're trying to figure out maybe why people are behaving in a certain way or why they're doing something in a certain way, and trying to understand that. Or we might have a situation where we have like some findings that we see are coming out in a quantitative setting, for example, or in documents, or there's opinions around certain things, but they don't actually match what we're seeing in real life or in different settings. So I might want to unlock a little bit more information about that. So one of the big things that comes out that people kind of get a bit scared about in research and qualitative research is the role of theory and conceptual frameworks. And it doesn't have to be scary. It's just something that we need to think about. And the reason we need to think about it is because us as researchers are the research tool in qualitative research. Now, in reality, in quantitative research, we kind of also are, because we're designing the studies and we're saying, well, this is what we're looking at, this is what's important, this is how we're measuring it. So we're still kind of the tool, but in qualitative research, we're much closer to the research itself, and we're putting more subjective experiences on what we're doing. So it's really clear that we need to be really clear about why we're doing that and how we're doing it, and how that influences the research and the sort of knowledge that's being produced from what we're doing. So we need to, any assumptions we make, we need to be really explicit about that. So and you need to be really cognizant about how who you are as a researcher is influencing what you're doing. So the way when we're talking about theory and conceptual frameworks, that's kind of a way of articulating how you're looking at the world and how that might influence the data you're collecting and the way you're collecting it. So it's really, if we're nominating a theory, and when we're talking about big T theories here, so like feminism or social constructivism, and we're really just saying this is the lens we're looking at the world through, and that's how that might influence the work we're doing. So it's a way of connecting, it's also a way of connecting the study findings to a wider context by saying, well, I'm also looking at it through this lens when I'm analysing the data and drawing it back to that setting. So we need to make decisions when we're designing studies about a bunch of different things, but we need to think about, obviously, the way we're analysing the data is one of those things, and we can talk a bit more about that, but it's also important to think about the whole process. So how are we going to collect the data, who's going to collect the data, what setting we can collect the data in, and we want to make sure that when we do that, it's in a way that's kind of all aligned to answer the research question. So we're going to talk a little bit more about content analysis and thematic analysis, but discourse analysis and narrative analysis are also very important tools and can be really helpful in health settings. So I just want to talk a little bit about what mixed methods research is as well. And the reason I bring that up is because it can also be very helpful in this setting, and particularly if you're thinking about like bringing health ethics into more of a clinical setting, might want to be combining qualitative and quantitative methods to explore the same or similar aspects of the same research question. So mixed methods research can be helpful where you don't always have so maybe the quantitative data alone or the qualitative data alone don't actually answer the research question completely, because you're only getting like one side of the story. So it can be helpful to explore both. Sometimes it can provide much more meaningful conclusions because you're sort of triangulating the data. So you're getting some from different areas, and it might help you understand what's going on a bit more so you can extrapolate further from it. It might make it more generalizable. So if you're just doing interviews, for example, with a small number of people, that might not be very generalizable to a broader population. But if you then, for example, did a survey with a broader population, using that data to help inform it, that might actually help you understand more and be able to extrapolate the findings more generalizably to a broader population. And it can help contextualize it as well. So it might help you figure out a little bit more about what's going on around the topic or around that setting as well by using mixed methods. So I'm just going to run through 4 of the main types of data collection using mixed methods. And they're in 2 broad categories. So the first broad category is simultaneous data collection. And that's where you might have, so the first part would be, so the first sub part of that would be embedded, which is where you have obviously one part of the research embedded in the other. So it's happening at the same time, but there's like, say, for example, a large scale survey. And within that, you might have some open-ended responses, which are qualitative. So you're going to analyze those kind of sort of together, but sort of separately, and mix them together in a bowl, which I've got there. And so then that helps you understand what's going on in that broader setting. But those questions within that would be quite similar. For example, you might have a survey that's talking about experiences with receiving genetic test results or something like that. And the open-ended responses would relate quite closely to that broad question. So that's the first type of simultaneous data collection. And then the second type is where it's called convergent parallel or triangulation. And that's where they're happening at the same time, the 2 qualitative and the quantitative data collection, but they're happening separately and there might be slightly different questions, for example. So you may have, say, interview data talking about experiences with like people's experiences with receiving genetic test results, but then you might have a broader survey that's asking people in the general public about what they think they might feel about genetic test results. So it's more, they're slightly different questions, but still related. And then you're going to analyze them separately and then bring them together to compare the results and then interpret the data. So it's happening simultaneous because it's data collection at the same time, being analyzed separately and then brought together for the analysis. Then you've got two types of sequential data collection. And the first one is explanatory. And that's where you first would go for like a broader approach. So you might do a big survey first and you're trying to understand what's going on in a broader population. But then you might have something that like triggers some more questions that you might have. So they're happening. So afterwards, so sequentially, you would have interviews that you might do, for example, with like a subset of that population to try and unpack a little bit more about what's going on around a particular question. And then in comparison, then you might have an exploratory sequential approach, which is where you might first try to understand a little bit more of what's going on in that setting, because maybe there's something you don't actually know anything about that area. So it'd be hard to design a survey. So you might want to do some interviews first with a smaller group of people to try and understand what's going on. And then after that, you might extrapolate that to a big quantitative survey to try and make those findings more generalizable. So they're the different types of mixed methods. And I just want to give you an example of some of my research and how I've used some of these mixed methods to kind of try and unpack some of this. So basically, the area I've been exploring a lot in my career has been looking at reporting results from diagnostic genomic sequencing. And we know that introducing genomic sequencing technologies in the field has really led to much higher diagnostic rates. And this is particularly in areas like rare disease. And we know there are guidelines that exist for how to analyze that data and interpret and report those findings. And this is one of the most important ones that was published in 2015. But the thing is, when that was published was around the time I started doing my postdoc. And at that time, we didn't really know how they were being used and how effective they were, or how people were sort of finding them in use, but also what that was meaning in terms of what was being reported to patients after being reported to clinicians. So I wanted to sort of unpackage that a little bit more. So one of the things I started with, trying to understand what was going on in laboratories. So I used what would be an explanatory sequential approach. So first, I did some qualitative work. So I wanted to unpackage a little bit more about what was going on for the people who were doing the analysis, so the laboratory scientists. So I did interviews with them first. And then I did interviews with the clinicians who were receiving reports from those scientists to find out how they were receiving the reports and what they were getting. So first I did all this qualitative work to sort of try and understand what's happening in the field. And then I did some work with a group in Utrecht in the Netherlands. And so I paired up with a laboratory scientist and also a bioinformatician and a clinical geneticist. And together we designed a study where we actually got together some virtual patient data. And we then used that in order to get laboratories to analyze that data and issue us reports as though we were a referring clinician. So it was kind of like a quality control sort of study, but we used those reports. So we analyzed the reports they sent us and used those sort of in a qualitative fashion, but then we also analyzed there's some questionnaires that we got them to fill out about their rationales for reporting and stuff like that in a more quantitative fashion. So that was really helpful because it showed us that it was a total mess. And I'm aging myself again with this slide for anyone who recognizes it. But so what happened was that we figured out it was just a mess in terms of the reporting. And so that was really helpful for us because it meant that we could, from that, using the qualitative component as well as the quantitative component, it helped us really identify what the problem was, because sure, we got the reports that we analysed, we also had the questionnaires together that helped us understand what was going wrong in terms of what they were doing and how it was reaching the outcome that was so disparate across the different laboratories. And so it helped us, doing the qualitative work and the quantitative work together, helped us figure out which questions to ask at different time points. We had a much broader reach because we were not just doing interviews, but we managed to get about 40 laboratories to participate in this, which is a lot. And doing interviews with all of those, as well as the other interviews, would have been a lot of work. So having a more systematic approach for examining things was really important. It meant it was more generalizable. And the next thing we've been doing is developing a template from all those reports back and trying to roll it out hopefully in the next year or so. So I'm going to hand over to Fiona now, who's going to talk a little bit about some more analysis and data collection methods. Thanks, Fi.
Thanks, Danya. So yeah, I wanted to talk a little bit about some qualitative data collection and analysis methods that Danya and I have experience with. They're also some of the more common ones that you might come across in literature or ones that you might consider using yourself. We could talk for hours and hours and days on these methods, but we really just wanted to give you a bit of an overview. So first up, let's talk about data collection methods. Two of the most common and two that we have experience with are interviews and focus groups. So let's talk a little bit about the pros and cons and the considerations for either of them. So in an interview, traditionally you'd have sort of a one-on-one setup, one interviewer and one participant. You might have something like a one-on-two setup, one interviewer and two participants. This is particularly useful, for example, with some of the work we've done with in the pediatric space. So you might have two parents where they're talking about a similar experience, or they're talking about the same child, for example. So something like that might work. Focus groups, obviously, you need at least two participants to have that discussion, and that's really the purpose of a focus group there, is to get the participants talking to each other about a particular topic or phenomenon of interest. So in terms of interviews, they really provide the space and the time for that sort of in-depth, detailed insight from that one participant. They're not getting interrupted, they're able to answer questions in whichever direction they choose. So that's really the benefit of an interview. In terms of focus groups, they provide similarly rich data, but in a slightly different way. So it's less in-depth per participant, but might be more in-depth about a particular topic or that phenomenon that you're interested in, with really those group dynamics in play there. So in the interview, the only interaction you've got is between the participant and the researcher, or your couple of participants and the researcher, but those focus groups provide an opportunity for peer influence there. And that can be beneficial. It can be detrimental too, depending on your topic area, but it's just something that needs to be considered. So in the interview, the researcher has the maximum amount of control about question and pacing. You can sort of guide the conversation how you might like. In a focus group, you certainly have control as the facilitator or co-facilitator, but less control there, in that the whole purpose of a focus group is that participants are sort of bouncing ideas off each other. And so there's less opportunity there for you to kind of rein things in if needed. Interviews are really well suited to things like those sensitive topics because they're a little bit more private. They're usually one-on-one. They allow the participant to sort of share as much or as little as they'd like. Focus groups are beneficial in you've got that social setting, so you've got that peer-to-peer dynamic that can encourage people to speak up. And I think, Danya, you'll agree that we've certainly seen that in some of the focus groups that we've conducted. But it can also mean that people don't speak up, whether that means that their opinion is different to the wider group and so they choose not to share it, or if it's a particularly sensitive topic or they're different in some way, they might not speak up there. So in terms of the time consideration for interviews and focus groups, interviews themselves are time consuming. You're only getting one participant per interview, and interviews might last anywhere from 15 to 20 minutes to an hour and a half or longer, depending on your topic. Focus groups allow you to capture many participants at once. So in that way, they're more time efficient, though they can last for a long time. I mentioned this before, but sensitive topics might be better suited to interviews just because of that sort of peer, that social dynamic in focus groups. In terms of logistics, and this is something that I'd be happy to speak to, interviews require less coordination. You're only sort of booking in a time that suits for yourself as the researcher and the participant. You can be flexible in terms of conducting them by Zoom or some other technology on the phone or face-to-face, whatever suits for your participants and your topic. Focus groups require a lot of work to coordinate. You're trying to find time that suits for lots of different people, and coordinating all of, the technical issues and everything that comes along with that. There's many logistics involved. In terms of analysis, interviews, so both interviews and focus groups, you would usually record and generate a transcript from them. Those interview transcripts can be easier to analyze in that the responses are usually relatively clear. They're sort of more structured, more individualized. There's less kind of speaking over each other. Focus group transcripts can be a little bit more tricky in that way, in that you've just got a conversation that's happening with lots of different people. People are often talking over each other. People are being cut off a little bit more. It can generate sort of a different data in that way, I guess. So when you're deciding about interviews or focus groups for your particular area, those are some of the considerations. Those interviews really allow that deep exploration of individual experience, which is particularly important for some topics and populations, sensitive topics, and those diverse perspectives. Focus groups are really useful when you're looking for understanding of group norms, social dynamics, and collective views. And they're also useful to capture lots of views at once. The other important thing to consider when we're talking about interviews and focus groups is the online versus in-person, or even if you might consider by phone for interviews. There are several different logistical considerations that you might think about there. Many of the focus group projects that we've conducted have been with participants from all over Australia, for example. And so focus groups are really the only way we could conduct these projects with multiple different people from different areas. But you might consider that in-person focus groups are more appropriate, say, for a particular patient population that's going to be in one place at one time, if they're relatively geographically localized. Focus groups can be a really nice, in-person focus groups as well can be a really nice environment for people to come and meet other participants. It's a little bit slower paced. You have an opportunity to build rapport a little bit more face to face. Same is the case with interviews. Those face-to-face interviews can feel a little bit more personable, but similarly, conducting something by Zoom or by phone is often just more convenient to participants. And if that means that you're going to be able to access your participant population easier, then that might be something that you need to consider. Certainly in my experience with some interview projects that I've been involved in before, I've done a combination of those. So some in person, some by phone, and some by Zoom. For some background, these were, my participants were parents of young children, and particularly critically unwell children. And so really getting them on board in any way possible was the most important consideration for that project. And so allowing them that flexibility, allowing participants to choose how they would like to participate was really important for that particular project. Some of the other things in terms of online versus in-person, you might consider the technological capability of your participants. So some of our focus groups we've done have been with a real range of people in the Australian public. Young adults, older adults, people of all different socioeconomic backgrounds who might have different levels of access to technology and comfort using technology. We've got around some of those issues with providing participants or potential participants with an opportunity to practice using the technology, or some, one-on-one guidance or training from us as the researchers in terms of, this is how you use Zoom, this is how you download the app and log in and those kinds of things. And then providing some guidance too about making sure you're in a quiet room, making sure you've got a stable internet connection, joining on a laptop or an iPad rather than a phone have been really useful pieces of guidance for participants. So lots of those sort of logistical things to consider when deciding whether to do things in person, by telephone, or on a technology like Zoom. So those are the data collection methods. Once you've collected the data, it's really common then to go ahead. And so in that data collection, you would record any conversations that happened, then you would go ahead and transcribe them. And then you're looking at how you go about analysing that data. Two of the common methods that you'll see written about a lot in the literature and that we have experience with are thematic analysis and inductive content analysis. There is much confusion between the two, and even now people will say they're using one and they might not actually be using it. There is terminology that's used sort of not always very consistently, and published research doesn't always describe exactly what's being done. So it can be really tricky if someone says they've done something like thematic analysis to actually know exactly what they've been done. Now, there are improvements in this space, particularly in terms of reporting qualitative research, that are really encouraging authors to describe exactly what's been done rather than just labeling a particular method used. But it's something to really be aware of when you're reading literature, certainly, that what people say they've done is not always exactly what they've done. So thematic analysis, for a little bit of background, has been used since around about the 1970s. It really came to fruition in the 80s and the 90s, and is being used a lot now. It's similar to content analysis, but as I suggested before, it's not very well described, and it's not very well defined. There are three overall types of thematic analysis: the coding reliability method, the codebook method, and something called reflexive thematic analysis. Reflexive thematic analysis is what I have the most experience with, and I believe it's what most people are talking about when they're talking about thematic analysis in current published literature. So reflexive thematic analysis is really useful when we're designing those, what we call big Q qualitative research projects. So these are often coming from a qualitative framework, so something like a constructivist or interpretivist framework. They're particularly suited to a particular type of approach called phenomenology. So this is where we're interested in a particular phenomenon as described by the people experiencing that phenomenon. Reflexive thematic analysis can be used to analyze many different data sources. So whether that's interview transcripts or, as Danya described before, media sources or some kind of visual material. It can be used to analyze many different things. The purpose of thematic analysis is to develop those themes, which are meaning-based patterns. So thematic analysis is really about generating meaning from the data. And Danya mentioned this before, but the researcher plays a really important role here. So the researcher is not an objective research tool, but they're actually part of the data analysis. So something that I hinted at a bit before, this was a project that I have the most experience using reflexive thematic analysis in. This was my PhD project. And I was really interested in how this particular type of genomic sequencing, rapid genomic sequencing, could be delivered in the acute care setting. So these are for critically unwell infants and children. So how can we deliver this new technology to patients and their families in a patient-centered way? So for this particular part of the project, I was interested in investigating the experiences of parents of these critically unwell children who had been offered rapid genomic sequencing. I used a constructivist or pragmatist framework and phenomenology to design this project. I conducted semi-structured interviews with parents. So this is where I said before, some of these were one-on-one with parents, and some of them were with both parents at once. And I use reflexive thematic analysis to analyze that data. So that's reflexive thematic analysis. Another method that we have a lot of experience with and that we use quite commonly is something called inductive content analysis. This is another qualitative method, usually used for analysing text here. So similarly, interviews, focus groups, or some kind of media source potentially. And the goal of inductive content analysis is to produce an overall summary of multiple texts. So that might be multiple interview transcripts or multiple focus group transcripts. The inductive content analysis means that you're generating your results from the data rather than taking an existing framework, for example, and trying to impose it on the data. So your results are really coming from the data themselves. And a really important process of inductive content analysis is the process of iterative analysis or iterative coding. So this is really about through your analysis, you're often still conducting your data collection. So you might be analysing previously conducted interviews while still conducting further interviews, and you're adjusting your analysis as you go. When can we use inductive content analysis? We can use this when we really don't know much about a topic. You can also use reflexive thematic analysis. In this case, most qualitative research is designed when we don't know much about a topic and we're really trying to explore it. If we're thinking about the intended outcomes of description and comprehension, so we're trying to understand something that's happening, understanding a phenomenon, inductive content analysis can be really useful. It's particularly useful when we're trying to make some impact on practice or policy, and this is how we tend to use inductive content analysis in our work. We've got an idea about what we're trying to impact or improve, and so we're using inductive content analysis to get to that goal. And so it's about those really practical outcomes here, which makes it particularly useful in the work that we do in health. So an example of how you might use inductive content analysis, this is one of Danya's projects. So this particular project was interested in wanting to understand why parents want to know their unaffected child's genetic carrier status, with the aim to explore parents' experiences of requesting carrier testing for those children. Similarly came from a constructivist and pragmatist framework, and similarly used semi-structured interviews with parents, but with this approach, Danya used an inductive content analysis to analyse those interview transcripts. So just a bit of a summary here in terms of reflexive thematic analysis and inductive content analysis. So thematic analysis is really suited to more of those theoretical research questions, but its defining factor is that it constructs themes, so those meaning-based patterns. So themes are more than just summaries of the data. Reflexive thematic analysis tends to be a slower, more in-depth process as well. Inductive content analysis is really suited to more practical research questions, and it constructs categories rather than themes. So those categories are broad ideas, concepts. You might have some subcategories in there as well. You can utilize theory, but it's not required. And inductive content analysis is often quicker. So in terms of an overall summary about using qualitative research methods, they can be used in many different ways. There are many, many different options over and above what we've even talked about today. They can be used as standalone methods. They can be used included in a mixed methods approach with quantitative methods as well. Qualitative and quantitative methods don't have to be separate. They can be used separately, but they don't have to be. And you can combine them for different insights or for different research questions and for different goals. But important in deciding which methods you're going to use, you need to be thinking about the right participants, the right way, and the right data collections to suit, the right data collection methods to suit your research aim. That's everything we have for you. I'd love to open it up to questions. Like I said, we've got some additional resources and much, much more we could talk about, but I might let our audience guide us from here.
Thanks, Vee. Thanks, Danya. Very, very interesting stuff. I'm always so impressed with you qualitative researchers. All right, well, thank you both for a wonderful seminar. I'll thank Catherine as well for putting in links to MCRI's qualitative research resources and link there. And I'll also note that if you're not a member of the Helen mailing list, we've got a link in the chat as well if you want to sign up. But yeah, I want to thank Fiona and Danya again, and we hope to see you at the May Helen seminar. Thanks all.